Hello, everyone, and welcome back to another episode of Let's Keep Moving with the APDA. We want to thank everyone so much for joining us today, and thank you for your continued support. Um, my name is Teresa, and I am one of the physical therapists at Boston University Center for Neurorehabilitation. And our topic for today is balance training to reduce falls in people with Parkinson's. So, by way of introduction, I know you may have seen this is our team here at Boston University Center for Neurorehabilitation and the APDA Rehab Resource and Referral Center. I know you see the team here. This is our contact information. If you'd like to follow us on social media, we would certainly love that. Some of you who may have joined us in the past know that we present these webinars as general information and not individual advice. So we suggest that you please do consult your individual physical therapist or your physician for recommendations that are right for you. The other thing I'd like to mention is that in our past webinar series, we have talked about balance as a topic. We've talked about the components of balance, what goes into a balance assessment, and some other ideas for treatment strategies for balance. So if you haven't had a chance to watch some of our past episodes, you can check out the Let's Keep Moving YouTube channel, and you can view all of our past episodes. So we thank you so much for all of that. Okay, so on to our topic for today. So balance is a concern for people with Parkinson's. One of the major movement or motor signs of Parkinson's is postural instability, or another way to describe that is difficulty with balance. Some of the other major motor signs of Parkinson's include bradykinesia, which is a slowness of movement, and rigidity, which is a stiffness of movement. And all of these things together can contribute to difficulty with balance in that they can change someone's balance reactions, maybe make the balance response a little slower or a little bit less effective when balance is disturbed. So these problems can make people unsteady with standing, with transitional movements such as standing up from a chair, and certainly unsteady with walking. So it's definitely an area of concern. And even more so because impaired balance puts someone at greater risk of falling. And what we know is that people with Parkinson's are at a greater risk of falling. Approximately 60% of people with Parkinson's report at least one fall per year, which is a higher rate than kind of age comparable older adults. The other thing we know is that falls for people with Parkinson's are associated with a greater rate of injury, particularly an increased incidence of hip fracture. Falls are also a major contributor of disability and decreased quality of life. So this is definitely an area of concern and an area of focus for us. Another thing I want to point out is changes in balance can begin early in the course of Parkinson's and can contribute to an increased fall risk even early on. And I'd just like to share one research study showing this. So this is evidence that comes from a study in Norway called the Norwegian Park West study. And this study enrolled people who were newly diagnosed with Parkinson's, and then another group of people who did not have Parkinson's. And they followed up with both groups over a 7-year period. So what you can see here in the figure is that the group with the squares and the line that connect the squares are that it's the higher line in the figure. And then the group with the triangles and the lines that connect that show the group of people who do not have Parkinson's, so considered to be the control group. And on the vertical axis, what you can see is the percentage of participants in the study who reported falling. So one thing that's notable is that even in the beginning, people who were just newly diagnosed with Parkinson's, even before they started medication, in this particular study, 15% of that group had already reported a fall very early on in the stage. And over the course of this particular study, which was again a 7-year duration, about 64% of people in the group of people with Parkinson's reported a fall. And I think one of the other striking things is you can see the difference in the two lines. So again, the line on the top represents people who do have Parkinson's. You could just see that the percentage of people falling is quite different between the groups. So it is something we know that can be impaired early and present a risk to people even early in Parkinson's can be at risk of falling. So that brings us a little more to the focus of today's topic, which is what does the research show for the evidence for interventions to reduce falls for people with Parkinson's? So there is one particular study that I want to draw your attention to, and I will talk through the figure on the screen here. This study is what's called a systematic review study, and this one was published last year by Dr. Natalie Allen from the University of Sydney in Sydney, Australia. Dr. Allen and her colleagues conducted this review study, which is really a summary of all research studies that are applicable to answer a specific research question. And in this case, the question was, what does the evidence say? What does the research say about the effects of interventions designed to reduce falls for people with Parkinson's? And so in this figure, I just kind of explain what some of the small writing is, but what each horizontal line of text and a little bit of a kind of a symbol over on the right-hand side, that represents a different study. And what across the bottom, where there's kind of a large diamond, that represents the summary of all the information with these other research studies. And because there have been several studies now done looking at the impact of exercise on falls, the researchers pulled together the results of all these studies so we could have a better idea of what is the bottom line. And the bottom line is really the diamond that is sort of at the bottom of the screen. It favors, you can see that it falls kind of to the left of the center line. So the summary of the results of all these studies favor exercise. And what we mean by that is these were all studies looking at exercise compared to a control group. And for the most part, the control group was someone's regular activity. So exercise compared to a control group, in summary of all these research projects, reduced the rate of falls, people with Parkinson's, by 26%. And that is really some strong evidence there. And the rate of falls was the amount of falls people were reporting per person per year. So that's what we mean by rate. And so, in summary, the exercise compared to a control group reduced the rate of falls. And so that might lead to kind of the natural next question, which is, okay, if exercise is effective, what type of exercise was effective? What balance exercises? And what the researchers did in this project was they broke up the research studies into the types of exercises that were performed. So again, what we can see, these small lines going across represent the individual studies, but in summary, these kind of more diamond shaped, that is kind of the summary of all of the studies in each particular group. And you can see for these three different style of exercises, one they termed gait and balance style exercises, that was shown to be effective. Resistant style exercise was also shown to be effective. And then Tai Chi as an exercise intervention was also showed to be effective. And so that's really good news because what it's really giving us information on is that people can choose. These different styles of exercises were all effective in reducing falls for people with Parkinson's. And so you might kind of ask, or we might ask, well, why? Why were these all effective? In a certain aspect, they were all doing a similar thing, despite being different style exercises. They were challenging people's ability to control their movement and to move in different ways with different activities. And again, that's good news because it's really indicating that there's not just one single best type of exercise to reduce falls, that there's multiple types of exercise, and that really gives people a lot of different choices. Another thing that the researchers looked at in their project was the amount of supervision that was kind of in these different exercise interventions. So you can see they did a little bit of a subgrouping in the top part of the chart here. These are studies where the exercise intervention had 100% supervision. So you can imagine that that's someone who's with the exercise intervention and monitoring and what have you. And then there was a group of exercises where there was less than 100% supervision. You can see that in both groups, they favored the exercise. So they were more effective than the control intervention. But there was a little bit of a stronger response in the studies that included 100% intervention. And we might kind of say, well, why? Why is that? And it's likely because in the supervision groups, it may have enabled the participants to challenge their balance a little bit more. It may have enabled a little greater participation with someone's right there, kind of watching and monitoring. And it may have enabled a little bit more specific attention with the program. But it's just one other thing for us to keep in mind, that made the exercise interventions a little bit more effective when there was 100% supervision. So having this kind of information that we know the exercise is more effective than a control group, we have some ideas of various types of exercise, and then some ideas related to how supervision played a role in the effectiveness of the exercise. What are some other kind of components of balance training? And there are several slides that I'd like to go through with different ideas about components of balance training. But I'm very curious, for anyone that's here on the chat today or in part of the audience today, my question for you is, are you engaging or participating in balance training? And if so, would you share what you enjoy about it or what's working for you? Because I think some of those stories from people in the audience and some of the information is really quite helpful. But when it comes to balance training, what we do know is that balance training really needs to challenge people a little bit beyond where they are now. So we know it should be challenging, and we say multidimensional. These pictures just give a little bit of an idea of that. In these pictures, people are working on stepping in different directions, maybe different challenges. You can see one picture, there's a gentleman who's tossing a ball back and forth. You can see people are stepping outside of their kind of narrow base of support and really engaged in kind of different activities to challenge balance. We know that other components of balance training include differences in the environment. And so by that, what we mean is sometimes we're talking about uneven surfaces. In several of these pictures, you can see there's people walking outside. You can kind of imagine that there's a little bit of an uphill, or things may be a little bit uneven with this outside. Or even you can see this one picture, there's people walking along a very narrow plank surface. But really, even more complex environment, of just kind of an everyday environment. So you can imagine walking down a busy street or maybe in a busy store. Those environments are a little more complex because there's kind of more things to deal with, more information coming at people. So we know that balance training really needs to be at a level of challenge that people need to kind of operate in their everyday environment. So we want to include those aspects in balance training. Another avenue to really challenging balance is to try balance activities or routines where there's a cognitive component. And that really gets at an aspect of training that we might call dual tasking, meaning that there's more than one thing going on at a time. And often that's a movement aspect and then maybe a cognitive aspect. Some of these pictures are just giving some examples what we mean by that. In the top screen, you can see there's a gentleman who's stepping over these obstacles on the floor. And the picture is showing that he's also reciting every other letter of the alphabet. There's kind of the middle picture where he's stepping to different sort of dots on the floor, and someone is cueing him to lead with his left foot, lead with his right foot. So you're kind of responding to coaching tips, which does take a little bit of mental attention. And then in this one particular case, he's doing kind of a boxing movement, but the person who's with him is telling him to sort of punch or not punch. So he has to kind of really control what he's doing based on what he's hearing. These are just some examples of challenging cognitive tasks that also can be incorporated into challenging balance movements. And this one other example, there's a gentleman who's on the treadmill and he's interacting with a virtual reality screen. So it's another thing that's kind of taking his attention. But what he's really practicing is how to do these two things at once, where one portion of it is kind of a cognitive challenge. So these are just some examples of what we mean by complexities of balance training. One other aspect of balance training involves maybe some community-based programs. So this is something where it might be a little more of a group style situation. And these are just two examples that also have a good deal of research support behind them. Tai Chi has been shown to really improve balance and reduce the rate of falls. And again, you can see it from that other kind of summary research article we were showing. And again, dance, specifically the tango, has shown in the research to show improvements in balance, improvements in walking. And I think, again, because of the challenge that's involved in following the sequence and moving, and of course, there's the aspect of movement. And sometimes these community exercise programs have an aspect of the group that feels motivating. This is also where people's individual preferences can come through, and sort of people are able to join the style of exercise that they enjoy. So when it comes to maybe some more overall recommendations for, say, an optimal balance dosing, these are coming from some of the guidelines that we know the research has kind of led us to, meaning that the balance doesn't have to, it's not just one thing, and balance exercise doesn't have to just be one thing. As you've seen, the research supports multiple aspects or modes of training. So what someone does want to engage in is something that they enjoy, something that's maybe challenging for them, maybe has these more complex components, is particularly a cognitive challenge. And in terms of the dosing, balance exercise is something really people want to engage in 2 to 3 times a week, maybe consider up to 30 minutes. And that may be where some of a community-based class or programs kind of have that feel to it that you could maybe see yourself in a class for 30 minutes doing Tai Chi or dance or what have you. Really, some of the very key components is that balance training needs to be challenging. And sometimes that's hard to find what's the just right challenge, because of course, we don't want someone to be unsafe. But again, if it's not really a challenge to someone, then it's not really improving balance. We've kind of said, and the research sort of indicated that maybe in-person training or training that's supervised might allow for a greater challenge. But again, we want someone to have a safe but challenging training that they are able to keep up with at home. So it's something they can do with that more frequent, say 2 to 3 times a week dosage. And that leads to kind of a question that we almost always try to engage in with these broadcasts is, for this topic, in terms of balance training, when should someone seek physical therapy? Well, really, we advocate for early as someone can in their process with Parkinson's. And that could even be before you maybe notice any balance issues. But what's really important is to have a balance assessment to identify where there might be areas that your balance is challenged, or where perhaps you could use additional training. And really, we also want people to engage with a physical therapist if they do have any concern for balance, if they or their families are noticing a concern or noticing that something is changing. We really want to engage with someone to get them on a good program before something is happening, before a fall happens. And what we really want is someone to be able to go through a physical therapy assessment for their balance, to develop an individualized program that's really going to suit someone's particular needs and be at that just right level of challenge. So here at Boston University, you may know that we have an exercise helpline, and by that we have this toll-free number. We have an email, which is rehab@bu.edu, and we really love to help anyone related to any exercise-based question, or perhaps to connect with people to try to find a physical therapist in their area that might know more about Parkinson's, or might perhaps be able to help them through a balance assessment, or really give them again that assessment and then set up a balance training program that would work for an individual. Um, so I know that was a lot to cover in this presentation, but we are so happy to talk more or to really engage with anyone and take questions. For that, I'd like to bring on our colleague Tim Nordahl to kind of handle questions for today and really be able to bring more information to anyone here in the audience. Hi, Tim. Thanks for joining.
Hello, Teresa. Thank you so much. This is such an exciting topic. The Cochrane review coming out, like that level of evidence about the benefits of balance training is just, it's super exciting. So I hope it's exciting to everyone listening too. We have a few questions that have come in over the course of your presentation. I see a lot of people are kind of telling us a little bit about what they're doing for their balance training. A couple of questions came up about things like boxing or table tennis. So I was wondering if you could maybe just speak to the parts of those exercise programs that could be beneficial for balance.
Absolutely. And what a great question. And thank you to everyone for bringing that up. So in say a boxing style class, as you can imagine, there is quite a bit of quick movement, stepping to something, stepping with an arm movement, kind of listening to, say, the sequence that the instructor wants you to connect with your punches. So there is a lot of those same qualities we were talking about that the evidence brings to the forefront, embedded in the boxing class. And oftentimes those are supervised, and then sometimes you can get the sense that the class itself will kind of progress with the person as their their skill or their ability with boxing kind of progresses as well. So I think boxing can bring some of these really prominent components of an excellent balance program right in the boxing class. And similarly with table tennis, in terms of the quickness, in terms of the following, where you have to connect with the ball, in terms of what you may be engaging with your opponent or even with your partner, so many of those same elements, quick, complex movements, cognitive challenge, and then also fun and motivation to come back and participate. And sometimes that's a class that someone's engaged in more than once a week. So those are just two excellent examples of kind of really complex balance training embedded in a class.
Yeah, it reminds me of one of the comments I saw while you were giving your presentation. I have to give credit to Raju, who said the best exercise is the one that I will want to do. And I have to give you credit. I love that. I absolutely love that, because there's a lot of ways we can keep this kind of fun and engaging for you, but also get all the right components for you. A couple other people had mentioned things that sound a little bit like freezing of gait. So I know David and Steve had mentioned small steps and concrete feet and your legs getting stuck, which is kind of a little bit of a different problem. I don't know if you wanted to speak to that, Teresa. And I know we could also mention that we have done a presentation on different strategies for freezing of gait earlier that we can link to as well.
That is such a great point, Tim. And thank you to everyone for bringing up those points. Absolutely. With freezing of gait, very significant concern for balance, concern for the potential to fall. And so for people who are experiencing a freezing of gait, they also need a balanced training program. And sometimes embedded in that training, we didn't necessarily cover it in the research today, but are other types of strategies to maintain balance. So sometimes people with freezing of gait need a particular strategy to, say, initiate their steps. If it feels like the feet are just, hard to pick up and get started, sometimes we use a visual strategy. So sometimes people might step right to, a line on the floor or a cue. Sometimes people almost have a mental imagery in their mind about almost marching in place before they get started, or imagining, say, stepping over like a very small object. And sometimes people with freezing of gait use an auditory strategy. So the beat of music, the beat of a metronome. So there's definitely a very prominent place for a balance assessment, and then a balance plan that's safe for people who are experiencing freezing of gait, and then maybe some other style strategies.
Mhm. And Rich also asked, is walking 45 to 60 minutes a day considered a balancing exercise?
Oh, that's a good question. That's a good question, Rich. So I might have to answer that question a little bit with it. It does depend. Just congratulations with 45 to 60 minutes of walking. I imagine you're getting an aerobic workout, you're practicing the task of walking. In some cases, those are the major goals: speed, endurance. And in some cases, people want to be on a more level surface to really have them be able to keep up their speed without any difficulty in terms of stepping over something or concern about uneven terrain. I would say walking for the purpose of challenging balance may need to have a few other things embedded. And again, I say this kind of in a broad way, but I'd like to make sure people feel safe before they're trying this. So really, again, consulting with your individual physical therapist. But for walking to have kind of a balance component, may need to have some challenges related to maybe talking while you're walking with someone, maybe particularly kind of turning your head to see, maybe house numbers or car license plates, or maybe particularly you are trying to challenge balance with, say, an uphill or an uneven terrain because you want the advantage of working hard for your balance, which is wonderful. But perhaps in that case, it might be that that's not the environment to do your speed-based walking. So walking can have a lot of balance challenge. It just maybe have to have kind of the certain criteria and to make sure that's safe for the person who's doing it.
Yeah, like a little extra stability challenge maybe. And I hear us, we're still using that word challenge. And one of our participants actually asked, what does one mean by challenge? So that there's some sort of element of failure, like maybe 20%, he says. So I'm wondering if we could just speak to that, just to make sure everyone's clear on what we mean.
Yeah, that is such an excellent point. I really appreciate that question because you're right. We throw that word around a lot, and it may not always be clear what that actually means. So, what we mean is that the exercise or the movement may feel like someone has to work hard to control it, may feel like they might have to kind of adjust their feet to get sort of the balance that they want. It might feel like it's something that takes a little bit of agility, so they're kind of moving their feet quickly. Um, when we're recommending balance exercises, sometimes we ask people to rate themselves in the sense of, say it was a scale of 100%. If someone were to say, how challenging does this feel to you? How hard does this feel to you? On a scale of, say, 100% feels like it's so hard that I don't think I can do it. I think I might fall. Versus, say, 0%, you can imagine that feels so easy. I don't even have to adjust myself at all. What we're trying to go for is something right in the middle. Just say, roughly speaking, say a 40 to 60% challenge where someone feels like they have to work at it. So I guess challenge in this sense might mean it's not easy, but you don't feel like you're losing your balance. You feel like you can do it, but your body may have to react to complete the task.
Yep, yep. And I think we've probably got time for maybe one or two more. So another one that I saw we might want to have you speak to, Teresa, is I'm nervous that I might lose my balance during some of these types of exercises. So how can I stay safe?
Thank you for that question, whoever brought that up, because that is a component of this. And I know we keep talking about challenge. We certainly don't want anyone to get hurt. So again, I know this is everyone has to kind of adjust this to what suits their needs. But just for example, say someone is doing a series of movements where they're having to step out, make a bigger step, or they're having to move quickly with an arm movement at the same time. Perhaps someone tries that in a room where, say, they could hold on to the wall if they need to, or that they would be close enough to support themselves, say, on a countertop if they were really losing balance. It might be that in certain cases, someone might make sure that, say, the floor around them is clear. So if they're taking multiple steps to kind of catch their balance, there's no chance they're going to trip over something on the floor. It might be that, say, someone is trying something that, say, ends up where they're standing a little bit more on one foot, well, they might again have the other foot maybe toe touch on the ground so that they have a little bit of extra support. There are definitely ways to make sure someone can stay safe, yet try something that's a little bit maybe beyond their capabilities right now. That's where a physical therapist can really provide some excellent recommendations tailored to the person that we're talking about. It could also be that with balance training, things start out fairly gradually. So maybe something does start off feeling a little easier. And then, say, could you imagine, say, if someone is throwing or tossing or catching a ball or reaching for something, that then that object starts to become a little further away from them so that someone has to move their feet. So the idea that things could be modified, have something you could hold on to, and then maybe start gradually and progress. Some of the other things I would recommend to make sure people stay safe with the balance training.
Yeah, thank you so much for that tip, Teresa. I think I think we've got time for one more. And before I ask you this one, I just want to remind everyone if we didn't get to your question today, I definitely want to remind everybody about the APDA exercise helpline. So we have the phone number up online there, and there's also information for how you could email us. So if there's anything we don't get to today, you're welcome to reach out to us with that contact information. We're happy to get back to you as soon as we can. So the last question I think we can get to today is I'm taking a spinning class and walking during the week. How can I make sure that I have the time to add in balance exercises on top of that?
Oh, what a great question. And thank you. I know, Tim, we hear this from some people who are working so hard at their exercise routine. They want to make sure all the components are covered. And sometimes it comes down to what do people actually have time for? So, a spinning class, talk about the aerobic intensity, no question about that. But a spinning class, as everyone can imagine, someone is clearly sitting. So, not really challenging their stability, say, when they're on their feet. And then, say, this person is walking during the week. I know, as we addressed in one of the other questions, that may also be quite aerobic and you're practicing this quality walking pattern, but it might not be quite enough to really be challenging your balance. So this idea about making time for more exercise on top of what someone's already doing, my first suggestion would be, what do you see yourself enjoying? What do you see something that you would participate in, as I think one of the other commenters mentioned? The other thing I would say is that for some of these classes, say, for example, Tai Chi, it's just one type of exercise, but the flow of that class within, say, a 30-minute window might cover a lot of different, say, balance requirements. The other thing I would say to answer that is it might be possible that, say, with the help of a physical therapist, someone could design, say, a 5 or 7 minute balance routine that they're able to do at their home, and that might flow nicely with their day. And that might be something someone gets to, say, every other day. So it is important to have a balance component to someone's exercise program. But I recognize the challenge to kind of fit that in and coordinate with some other things people might be doing. And again, that's where I would just strongly advocate for everyone to connect with a physical therapist, so someone who can help you design a comprehensive program that meets your needs, but also fits in with really an everyday lifestyle, because we recognize that's a challenge too.
Yeah. Yeah.
Yeah.
Well,
Oh,
thank you so much, Teresa.
Tim, and thank you. Thank you to everyone who was willing to participate. What great questions we have today. And we really appreciate the questions that people are bringing to our attention too, because we know that's what's on everyone's minds. Again, we thank everyone for their support of these webinars. We're here at Boston University. I know you've seen that the exercise helpline. We want to be here to support everyone throughout the country, and we can do that with the help of the APDA. And then we also want to encourage people to continue with us with these Let's Keep Moving webinars as we have them coming up through the year. What we really want to do is have everyone check the APDA events calendar, which really gives a listing of all virtual events and then sometimes events that are happening in people's particular areas. So again, we cannot thank everyone enough for their participation and their questions today. And we really look forward to seeing you on the next Let's Keep Moving. Thank you so much.
Hi, I'm Leslie Chambers, the President and CEO of the American Parkinson Disease Association. Each month across the country, APDA is providing support groups, exercise classes, and educational programs like this one to support the Parkinson's disease community. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. If you enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Your gift can help APDA support people living with PD through local programs, reliable resources, and groundbreaking research designed to find treatments and ultimately the cure for Parkinson's disease. Please donate today at apdaparkinson.org/donate. And thank you so much for your support.